and we're tackling the topic of infertility to spread awareness and try to break down stigmas. 1 in 6 couples is impacted by infertility. And while it can be a really trying time for those faced with the challenges of trying to conceive, there are more options than ever. So there's hope and success for so many affected. Dr. Brooke Lamparello of St. Peter's OBGYN is here now with some great information for us. Doctor, thanks so much for coming in.
Thank you for having me.
We were just talking about this off camera and how we're starting to see people talk about this a little more and how social media is helping with this. But there are still so many who are afraid to speak up. Talk to me about, what you want your patients to know with regard to how this is something you mentioned. Infertility is a medical condition. It's not a personal failure.
Right. I think that there are so many people out there who are suffering in silence.
Yeah.
And they don't know where to start and they don't know how to initiate that conversation. And the most important thing to know is that there are many medical conditions which you can't control, which can cause infertility. And it's not just a female factor infertility.
Yes, and so that's just it, right? It's not just a woman's issue, it's a man's issue as well. Talk to us about that, and then you kind of alluded to this, some of the possible causes here of infertility.
Right, so, the infertility follows what we call the rule of thirds. A third of it can be female factor, a third of it can be male factor, a third of it can be both couples, or unexplained infertility. And there are a number of different medical conditions, things such as PCOS, endometriosis, a history of pelvic infections, or other medical conditions that can cause and lead to infertility.
When is it time to seek help?
So if you've been actively trying to conceive for over a year, and if you're under the age of 35, or if you're over the age of 35, if you've been actively trying to conceive for at least 6 months, if you're not successful at that point, then we do encourage you to seek care and talk to your doctor.
It's frightening, and it's something, as you said, that can be so challenging for couples, not easy to talk about, but something that I know you want to make very clear here is there's hope and there's a lot out there. So speak to us about that and some of the options.
Right, so there are many, many ways that we can help people nowadays to achieve their family building goals. There are medications, there are things like intrauterine insemination, and then there's IVF. And so the advances that we have these days are just so remarkable, and every single day there's more and more and more treatments out there for folks. That's good to hear.
That's really good to hear. This is a team effort, though, too, because we talked about this. Women are generally more eager or ready to say, okay, I can do this, or they think it's their fault. As we know, it isn't always the case. But you've really got to make sure that your partner's involved here as well.
Right, so the fertility journey can be not only emotionally stressful and very trying, but also in terms of working up male factor infertility. So having a male partner who is willing to undergo a medical workup as well to see if there is a male factor component is super important to getting to the bottom and the root cause to helping figure out exactly what's the underlying issue.
So it is best advice partner comes with the woman to the appointment when you're at this point, right?
Yeah, I think in an initial appointment when we talk about infertility, we will go very in depth about what things couples have been trying. So I think that having your partner come with you to that appointment would be super, super helpful.
I know that stress can even be a factor here, right? And when you're going through this process and you want so much to start a family,
yeah,
that can just be a snowball, right?
That can, anecdotally, we hear those stories all the time of people who have been trying for years and years and years, and then when they stop trying, they just spontaneously become pregnant on their own.
There are so many people among us who may have had these issues, and so just continuing the conversation is crucial.
Right, yes. It's important for people to understand that this is very common and that there are many, many, many couples who are suffering with this. And the first step is to talking to your doctor and realizing that you're not alone. There's also many support groups in the community that are helping to provide, emotional support, and psychologists providing emotional support and folks going through this.
Get help, right? And the sooner you do, the better it
Yes.
is. Yes. Doctor, thank you so much for coming in. Appreciate you talking about it. Thanks. And for more resources and to find all of our Women's Health Wednesday segments online, you can go to news10.com and look for Women's Health under the community tab. We'll be right back.